whether it's the AUA or the EAU, and they kind of tell us a direction that we should take. They give us some practical aspects, but they're really based on what's the best available evidence. Following the guidelines doesn't necessarily give us the best outcomes, and it never replaces good clinical expertise. And when I have a senior partner or my colleagues who've seen it all before, or a really experienced urology nurse, I listen to them because that clinical expertise is invaluable. And of course, we make a lot of our decisions not only based on research evidence, but also taking into consideration the personal values and the preferences and the circumstances of our each individual patient. And of course, guidelines, they're not mandates, they're not legal standards, they're just there to help us. But what I think guidelines really lack are taking into consideration patient values, patient preferences, how to make a decision when there's multiple options available, and they don't really give us an aid or a guide. And so, when we have a patient in front of us, we have to think about what is the diagnosis? We have to get the diagnosis right. And then what are the sort of the aspects of this individual patient that would lead us to the best type of care? So there's been a shift over the years away from BPH medications. And of course, for the last, I want to say 20 to 30 years, they've really been the cornerstone. Remember, before alpha blockers like tantalocin and 5-ARIs came around, we really only had lifestyle modifications and TURP surgery. But as time has gone by, we see that men are dissatisfied with medications. They improve symptoms quite modestly, to tell you the truth. It can take a long time for the medications to work in the case of 5-ARIs, and they are full of side effects, whether it's the dizziness, the lightheadedness, congestion, or sexual dysfunction like erectile or ejaculatory dysfunction. So there's been a shift away, I would say, a little bit amongst patients and urologists from medications. And then so when we look at this algorithm of guidelines, there are now just so many choices, right? We've got our traditional transurethral surgeries, and we have all of these minimally invasive therapies or MIST that have these different acronyms. And it can be really hard to know what to offer patients based upon their preferences, their prostate anatomy, etc. So the market, though, is really underserved. And what I mean by that is if you look at this whole cohort of men in the US suffering from BPH, the vast majority of men, 2/3, are just living with their symptoms. They'll never even see a doctor, or they're buying things late at night on television or on the internet or herbal products. And for those fewer men who actually get on to see a doctor, to see a urologist, to see one of the urology nurses, a portion of them are going to be waiting and watching their symptoms. About half are going to go onto drugs, and then a quarter of them are going to fail medical therapy. But in fact, in the US, a very small proportion of men actually make it to the doctor, make it onto drugs, fail those drugs, and then get on to an actual type of intervention. So there's a huge number of men that just fall off the back of the wagon, and who knows where they go. They're back to the beginning of the cycle where they have their symptoms unmanaged.